that nagging ache, that moment of forgetfulness. Are these just part of getting older, or could they be whispers from your body, trying to tell you something much more serious? So often, subtle signs can appear long before a major health crisis, but they get brushed aside. Ignoring these warnings isn't just a gamble, it's a risk with your health and your future. As we go through life, our bodies change. We get wiser, more experienced, and maybe pick up a few more laugh lines. But along with these changes comes a real need to pay closer attention to how we're feeling, both physically and mentally. It's easy, sometimes even convenient, to chalk up every new ache, pain, or bit of confusion to just getting older. But thinking that way can be risky. Many health conditions, if you catch them early, can be managed, treated, or even prevented. Putting off looking into a new or worsening symptom can lead to bigger health problems, a lower quality of life, and sometimes it can shorten a life that could have been lived more fully. This video isn't about scaring you, it's about empowering you. It's about giving you the know-how to recognize when your body might be sending out a critical distress signal. We're going to talk about 7 specific health warnings, covering both physical and mental changes, that seniors, their families, and caregivers really need to take seriously. These aren't just small annoyances, they're potentially big clues that something isn't right and needs quick medical attention. Understanding these signs is the first big step in protecting your health, keeping your independence, and making sure your later years are as vibrant and fulfilling as they can be. Now, before we jump in, it's really important to say this. The information in this video is for educational purposes only. It's not meant to replace professional medical advice, diagnosis, or treatment. Always talk to your doctor or another qualified health provider if you have questions about a medical condition. Never ignore professional medical advice or delay getting it because of something you've seen or heard here. Your doctor is your #1 resource for all your health concerns. Alright, the first warning sign we absolutely have to talk about is chest pain or pressure. This is, without a doubt, one of the most critical symptoms you should never, ever ignore, no matter your age, but it's especially important for seniors. Chest pain, discomfort, tightness, squeezing, or a feeling of pressure in your chest can be a major sign of a heart attack or other serious heart conditions like angina. Angina is chest pain that happens when your heart muscle isn't getting enough blood, usually because one or more of the heart's arteries is narrowed or blocked. Now we often see heart attacks in movies as sudden, crushing chest pain, but it's so important for seniors to know that your experience might be different. These can include shortness of breath that seems way out of proportion to what you're doing unexplained, and deep tiredness, feeling sick to your stomach, or throwing up pain in the jaw, neck, back, or even in one or both arms, dizziness or a cold sweat. Sometimes the discomfort might feel like indigestion or heartburn, and that can lead to dangerous delays in getting help. You just can't overstate the danger of brushing off chest pain or these less typical signs. Thinking it's just a bit of indigestion or I must have pulled a muscle can have life-altering or even fatal consequences. A heart attack means blood flow to a part of your heart muscle is blocked. If doctors don't act fast to get the blood flowing again, that part of the heart muscle starts to die. The longer you wait for treatment, the more heart muscle gets damaged. This damage can lead to long-term heart failure, irregular heartbeats, a higher risk of more heart attacks, or sudden death. Many seniors grew up in a time where you didn't make a fuss, or maybe they worry about being a bother or the cost of emergency care, but when it comes to chest pain, every single minute counts. The American Heart Association stresses that getting medical help right away is key to survival and to reducing long-term disability. Ignoring these signs isn't being tough. It's risking your life and your future chances to enjoy time with loved ones and do the things you love. If you or a senior you know feels any new severe, persistent, or worrying chest discomfort, whether it's that classic pain or one of the less typical symptoms like sudden severe tiredness or shortness of breath with a vague chest feeling, you need to get medical help immediately. That means calling emergency services like 911 or your local emergency number right away. Don't try to drive yourself to the hospital and don't wait to see if it goes away on its own. Paramedics can start life-saving checks and treatments on the way to the hospital. At the hospital, doctors can run tests like an ECG or EKG and blood tests to figure out if a heart attack is happening or if there's another serious condition. Quick action like clot-busting drugs or procedures like angioplasty to open blocked arteries can save heart muscle and save lives. The second health warning that needs immediate attention in seniors is sudden or unexplained shortness of breath. Sure, getting a little winded after some hard exercise is normal, but the kind of shortness of breath we're talking about here is different and a lot more worrying. Sudden shortness of breath, which doctors call dyspnea, is when you suddenly feel uncomfortably aware of your breathing, or like you just can't get enough air. This can happen when you're resting, doing very little, or it might even wake you up from sleep. For seniors, this symptom can point to several urgent and potentially life-threatening conditions. It might mean heart failure is starting or getting worse. That's when the heart isn't pumping blood well, causing fluid to back up into the lungs. Pneumonia, a serious lung infection, is another common cause, especially in older adults whose immune systems might not be as strong. A pulmonary embolism, which is a blood clot that travels to the lungs and blocks an artery, can cause sudden, sharp chest pain along with severe shortness of breath. Other possibilities include a flare-up of COPD, which is chronic obstructive pulmonary disease, asthma, or even sometimes a silent heart attack, where shortness of breath is a bigger symptom than chest pain. Dismissing sudden shortness of breath as just getting older or being out of shape is a dangerous mistake for seniors. Unlike the slow decrease in lung capacity that can happen with age, a sudden start or a big unexplained worsening of breathing trouble is a major alarm bell. If it's because of heart failure, ignoring it means the heart keeps struggling, possibly leading to more fluid buildup, a hospital stay, and a drop in overall function and quality of life. If it's pneumonia, delaying treatment can let the infection spread, leading to sepsis, which is a life-threatening reaction to infection or respiratory failure. A pulmonary embolism is a medical emergency. If it's a large clot, it can be fatal very quickly if not diagnosed and treated right away. Research shows that for seniors, shortness of breath might also come with confusion or a sudden change in alertness. That's an even more serious sign and should trigger the most urgent care. Imagine struggling for every breath, feeling like you're suffocating. This is not a symptom to wait out. The anxiety it causes can make the breathlessness even worse, creating a terrible cycle. The impact on daily life can be instant and severe, stopping you from doing simple things like walking to the kitchen or getting dressed. If you or an older adult you care for experiences sudden, unexplained shortness of breath, or if existing breathing problems get rapidly worse, it's so important to get an urgent medical checkup. Don't wait to see if it gets better on its own. Call your doctor immediately, or if the shortness of breath is severe, or comes with chest pain, dizziness, fainting, or confusion, call for emergency medical services without hesitating. At the hospital or clinic, healthcare professionals will work to find the cause. This might involve a physical exam, listening to the lungs and heart, measuring oxygen levels, chest x-rays or CT scans, blood tests, and maybe an ECG. Treatment will depend on what's causing it. For example, heart failure might be treated with diuretics, which are water pills, to get rid of excess fluid, and medicines to help the heart pump better. Pneumonia will need antibiotics. A pulmonary embolism needs blood-thinning therapy and sometimes more advanced treatments. Getting diagnosed and treated early can prevent serious complications, ease the awful symptom of breathlessness, improve lung and heart function, and ultimately save lives. Pay attention to your body. If breathing suddenly becomes a struggle, your body is telling you something is seriously wrong. Warning sign number 3. Confusion or sudden cognitive changes. Our third critical health warning, especially for seniors, is any new or worsening confusion or any sudden, unexplained change in thinking abilities. This is often a really unsettling symptom, both for the person experiencing it and for their loved ones. Problem. Acute confusion, often called delirium, is a sudden change in mental state where someone might be disoriented, not knowing where they are, the time, or who people are, have trouble paying attention, think in a disorganized way, and sometimes become agitated or the opposite, unusually sluggish. This is different from the slow memory changes that can sometimes come with normal aging or the gradual progression you see in early dementia. We're talking about a pretty quick shift here. Other sudden cognitive changes might include sudden difficulty making decisions, a noticeable decline in problem-solving skills, or a personality change that's out of character. These changes can be subtle at first. Maybe a family member notices them before the person themselves is fully aware. The potential causes are many, and they're serious. Infections like urinary tract infections or pneumonia are very common culprits in seniors and can trigger delirium even without other typical infection signs like fever. A stroke or a mini-stroke can show up with sudden confusion. Side effects from medications or interactions between multiple medications, something we call polypharmacy, are also common causes. Dehydration or electrolyte imbalances, which seniors are more prone to, can really affect brain function. Other possibilities include uncontrolled diabetes, very high or very low blood sugar, thyroid problems, organ failure like kidney or liver issues, or even the first acute signs of developing dementia, though dementia itself is usually a slower process. It's really dangerous to brush off sudden confusion or a significant cognitive decline in a senior as just a senior moment, or an unavoidable part of getting old. Acute confusion or delirium is a medical emergency in older adults. It's linked to a higher risk of complications, longer hospital stays, and even death if the underlying cause isn't found and treated quickly. Ignoring these changes can let a treatable infection get worse, possibly leading to sepsis. If it's a stroke, time is brain, and any delay in treatment can mean more extensive and permanent brain damage, leading to long-term disability. Medication side effects, if not spotted, can keep impairing cognitive function and overall well-being. Plus, the experience of sudden confusion can be terrifying for the individual, causing a lot of distress and anxiety. For family members, seeing a loved one suddenly become disoriented or unable to recognize them can be heartbreaking and alarming. The risk of falls or accidents also goes up dramatically when a person is confused. This isn't just about memory, it's about the brain's overall ability to work correctly, and a sudden problem is a major red flag that the body is under serious stress or that a critical system is failing. Any new or sudden onset of confusion, disorientation, or significant change in cognitive function in a senior needs immediate medical assessment. This is not a wait-and-see situation. Contact their doctor right away or take them to the nearest emergency department. Be ready to give a clear history of when the changes started, any new medications or illnesses and other symptoms they might have. The medical team will do a thorough evaluation, which will likely include a physical exam, blood tests to check for infection, electrolyte imbalances, organ function, thyroid levels, blood sugar, a urine test for UTIs, a review of medications, and possibly imaging studies like a CT scan or MRI of the brain if a stroke or other neurological issue is suspected. Treatment depends entirely on what's causing it. If an infection is found, they'll get antibiotics. If it's a medication side effect, the problematic drug may be stopped or changed. If dehydration is the cause, fluids will be given. The key is quickly identifying and managing the trigger. While not all causes of confusion are reversible, like advanced dementia, many acute episodes of confusion are, especially if they're addressed quickly. Early intervention can prevent further decline, restore cognitive function in many cases, and significantly improve the outcome. Warning sign #4, persistent or severe depression. Our fourth warning sign takes us into mental and emotional health, persistent or severe depression. It's so important to understand that depression is not a normal part of aging, nor is it a sign of weakness. It is a treatable medical condition. Problem. Depression in seniors can show up in different ways, and sometimes its symptoms aren't as obvious as in younger people, or they might be mistakenly blamed on other age-related issues. Key signs include a depressed or sad mood that lasts for more than 2 weeks, a major loss of interest or pleasure in activities that used to be enjoyable, this is called anhedonia, and feelings of hopelessness, worthlessness, or excessive guilt. Other symptoms can include ongoing tiredness or lack of energy, trouble sleeping, insomnia or sleeping too much, hypersomnia, big changes in appetite leading to weight loss or gain, difficulty concentrating or making decisions, and noticeable restlessness or, the opposite, slowed movements or speech. In some older adults, depression might look more like irritability, anger, or physical complaints like unexplained aches and pains rather than obvious sadness. Sometimes memory problems linked to depression can even be mistaken for early signs of dementia, a condition sometimes called pseudodementia. Ignoring depression in seniors can have profound and devastating effects. Untreated depression seriously reduces quality of life, making everyday tasks feel overwhelming and stripping joy from experiences. It can make physical health problems worse. For instance, people with depression may have poorer results from conditions like heart disease or diabetes because they might lack the motivation or energy to manage their illness well, like sticking to medication, going to appointments, eating healthily, or exercising. Depression can lead to social withdrawal and isolation, which then can make the depression worse, creating a tough cycle. This isolation is a known risk factor for further cognitive decline and even a higher risk of death. One of the most serious risks of untreated depression is suicide. It's a difficult topic, but older adults, especially older men, have some of the highest suicide rates. Any talk of wanting to die, feeling like a burden, or giving away prized possessions should be taken extremely seriously. The belief that it's just old age or that they have every right to be sad can stop people from seeking or getting the help they desperately need. This is a condition that causes immense suffering, and it's a suffering that, in many cases, can be eased. If you see signs of persistent or severe depression in yourself or an older adult you care about, it's vital to get professional help. Start by talking to a primary care physician. Doctors can screen for depression and rule out any underlying medical conditions or medication side effects that might be adding to the symptoms. Many physical illnesses or medications can actually cause depressive symptoms. If depression is diagnosed, there are effective treatments available. These often include psychotherapy, talk therapy, like cognitive behavioral therapy, or interpersonal therapy, which can help people develop coping strategies and change negative thought patterns. Antidepressant medications can also be very effective, though doctors need to be careful with older adults due to potential interactions with other medications and age-related changes in how drugs are processed by the body. Often, a mix of therapy and medication works best. Lifestyle changes like regular physical activity, staying socially connected, engaging in hobbies, and ensuring good nutrition and sleep can also play a big supportive role. Encouraging open conversations about feelings and mental health is crucial. Let the senior know they're not alone, and that seeking help is a sign of strength, not weakness. Early intervention can dramatically improve their mood, overall health, and outlook on life. Remember, feeling persistently down or hopeless isn't something anyone just has to put up with as they get older. Warning sign #5. Unexplained weight loss or significant loss of appetite. The fifth health warning we need to cover is unexplained weight loss or a noticeable and ongoing loss of appetite in seniors. While small changes in weight can happen, a significant, unintentional drop in weight is a red flag. Problem: unexplained weight loss is usually defined as losing more than 5% of your body weight over 6 to 12 months without trying. So, for someone weighing 150 pounds, that would be a loss of 7.5 pounds or more. A major loss of appetite, doctors call this anorexia, but it's different from the eating disorder, often goes along with or comes before this weight loss. It's not just about feeling less hungry now and then, it's a lasting disinterest in food or feeling full after eating very little. There are many potential underlying reasons for these symptoms in older adults, and several are quite serious. Cancer is a big concern, as many types of cancer can cause unexplained weight loss and appetite changes as an early symptom. Endocrine disorders like an overactive thyroid gland, hyperthyroidism, which speeds up metabolism, or poorly controlled diabetes, can also lead to weight loss. Digestive problems including ulcers, inflammatory bowel disease, or conditions that prevent nutrient absorption, malabsorption syndromes, are other possibilities. Chronic infections like tuberculosis can also be a cause. Neurological conditions, including Parkinson's disease or advancing dementia, can affect appetite, the ability to eat, or lead to increased energy use. Also, mental health issues, especially depression, often show up with a loss of appetite and subsequent weight loss. Side effects of certain medications can also suppress appetite or cause nausea. Brushing off unexplained weight loss or a persistent lack of appetite as simply slowing down with age or not needing as much food anymore can be extremely dangerous. This symptom is often a subtle but key indicator that something is seriously wrong inside the body. If the cause is cancer, delaying diagnosis means the cancer might progress to a more advanced stage, making treatment harder and less likely to succeed. If it's an undiagnosed endocrine disorder or a chronic infection, these conditions can lead to more complications and a general decline in health if they're not managed. Malnutrition, which always follows significant weight loss and poor appetite, has its own set of severe consequences for seniors. It can lead to muscle wasting, weakness, a weakened immune system, poor wound healing, increased risk of falls and fractures, and overall frailty. This can create a downward spiral in health and independence. The body needs fuel and nutrients to work correctly, and when it's consistently deprived, its ability to repair itself and fight off illness is weakened. Ignoring these signs means overlooking a potentially treatable condition and allowing a decline in health that might otherwise be preventable or manageable. If you notice a persistent pattern of social withdrawal or a significant loss of interest in usual activities in a senior, it's important to address it sensitively. Start by talking to them about your concerns in a gentle and supportive way. The first step is often a visit to their primary care physician to rule out or identify any underlying physical health problems. Review medications for side effects, and screen for depression, anxiety, or cognitive issues. If depression or anxiety is diagnosed, treatment options like therapy or medication can be very effective. If hearing loss is a factor, a hearing test and appropriate aids can make a huge difference. If cognitive decline is suspected, further neurological assessment can provide a diagnosis and a plan. Encourage participation in social activities that they might enjoy and are able to do. Technology can also help bridge gaps, with video calls connecting them to loved ones. Sometimes, just having transportation to social events can be a barrier that needs addressing. The key is to recognize that these changes aren't necessarily a harmless part of aging, but could be a sign that help is needed. Additional red flags. While we focused on 7 major warnings, it's good to remember that other symptoms also deserve quick attention. Don't ignore persistent, unexplained tiredness that isn't fixed by rest. This could signal a whole host of underlying issues. Noticeable changes in personal hygiene or neglecting self-care can be a sign of depression, cognitive decline, or physical inability. If a senior starts getting sick or having infections frequently, it could mean a weakening immune system. Any significant and lasting change from an individual's usual health or behavior warrants a conversation with a healthcare professional. Why early action matters. The common thread through all these warnings is how incredibly important early detection and action are. Acting promptly when these signs appear isn't about overreacting, it's about being proactive and taking control of health. First, early action can prevent complications or stop underlying conditions from getting worse. For example, finding heart disease early can allow for lifestyle changes and medications that prevent a major heart attack. Detecting cancer at an early stage dramatically increases the chances of successful treatment and cure. Second, getting medical attention in good time can significantly improve recovery and help maintain independence for longer. Addressing mobility issues before a serious fall happens can prevent debilitating injuries and the loss of autonomy. Treating depression can restore energy and engagement in life, allowing seniors to continue living fulfilling lives. Third, and perhaps most importantly, early diagnosis and treatment boost overall quality of life. It allows them to keep enjoying their hobbies, relationships, and activities that bring meaning and joy. Many health conditions don't show obvious symptoms in their early stages. By the time symptoms become severe, the condition may have already progressed. Don't wait for a problem to become a crisis. Your body often gives signals. Listening to them is one of the most powerful things you can do. So, we've covered 7 critical health warnings that seniors should never ignore. Chest pain, shortness of breath, confusion, depression, weight loss, mobility issues, and social withdrawal. These aren't just minor issues, they are your body's potential distress signals, indicating that something may be seriously wrong. Brushing them off as simply part of getting older can delay diagnosis and treatment, potentially leading to more severe health problems. Your health is your most valuable asset. Be attentive, be proactive, and always talk with a healthcare professional if you have any concerns. If this information has been helpful, please think about sharing this video with other seniors, family members, or caregivers. We'd also love to hear from you in the comments below. Sharing experiences can help others feel less alone and encourage them to seek help. If you found this video valuable, please give it a thumbs up and subscribe to our channel. Don't forget to hit the notification bell. Thanks so much for watching. Taking these warnings seriously is a vital step in looking after your health proactively. Stay informed, stay vigilant, and empower yourself to live your healthiest life.